So maybe your first question would be, give us a state of just your tribes. Madison has just been designated in December, Truax Field, as the home of F35A. Doctor, can you start? Give us an overview. WisconsinEye is providing information on how local officials and state officials are dealing with this health emergency by interviewing those on the front lines. Mark O'Connell is Executive Director of the Wisconsin Counties Association. Mark, thank you so much for taking time to talk about this very interesting time.
Steve, it's good to be almost with you, not in person, but WisconsinEye overcomes all. And so we're getting by with electronic and our new technology means.
Just like the counties, WisconsinEye is indeed trying. Give us an overview, Mark. Counties, essential services. How are county governments responding in this crisis?
Well, that is a very good question. This is how should we say, a once in a multiple lifetime challenge that we are facing as not just counties, but our friends in cities, towns, villages, school districts, as a state, quite frankly, as a nation, and I guess as a planet. This is something none of us expected. A month ago, we'd have been doing this show one-on-one, face-to-face, talking about the last day of session that the Senate was going to take up. Yes. Now, everything else is on hold because we have this massive pandemic affecting every one of us and certain portions of our population more so than others. In county government, I guess most people would know, we are the service delivery arm of all that the state believes is important to our citizens. So when the state sees a challenge and implements a program or passes laws to create a program, oftentimes counties are asked to perform and carry out that program, whether it's law enforcement, whether it's public health, whether it's human services, law enforcement, transportation, all of it. In this particular case with this pandemic, all of these charges, all of these functions, all of the programs that we work together with the state of Wisconsin on are all being put to the test, not just because we have increased demands in several areas, but also because the normal way we might engage in our business has been compromised. We cannot work face-to-face in many cases. We have buildings that are shut down. We have working with our court system and our judges, some courtrooms are open, some courtrooms are closed. We can't interact with people on a counter basis. Basically, the world has sort of taken a time out and stopped, and much of what we do in county government and in assisting the public and serving the public has been put on hold.
Mark, as we speak, the Wisconsin Elections Commission is going back and forth on the logistics for the statewide election 1 week from today. The governor, legislative leaders have said the elections will be held. Was that the right call, sir?
This is an incredibly challenging issue. On the one hand, we have in our democracy, we have the people elect our leaders, and we have a structure to make that happen. We also have a tremendous number of volunteers at the city and village and town level that take care of these elections. In this case, that the people that take care of these elections are some of the at-risk populations. So we need to be aware that we need to take proper precautions so that we make people as comfortable and keep them as healthy as possible. Now, at the same time, it is important that these elections move forward from county government's perspective, because our terms are limited. Our county supervisors don't continue in office until the office is filled by someone else. Right. Our terms of office are set. So if we don't have an election, we have no county board. We have no county the policymakers or decision makers, and in essence, counties would be at a loss in terms of policy direction. We still have employees, no question about that, and we still have administrators and some executives would maintain office, and department heads would be in place, but we wouldn't have any policy direction, and that puts a big question mark on our democracy. So, is it the right call? Time will tell. From the county's perspective, we believe that the elections need to happen for us to have a county board to actually operate county government.
Well, some of our larger communities, the Milwaukee, the Madison, the Green Bays, the Waukesha's, those city clerks have perhaps more resources. So my question is, if someone is planning on going to the polls. They have not sought and got an absentee ballot a week from today. In some of these outstate counties, what should they be prepared for, Mark?
Well, I think you're going to be prepared for some longer lines, a very limited number of people being invited into the actual polling place. You're going to be, there's going to be some, when it's available, and hopefully it will be available in all cases, the protection equipment that our poll workers will use. I would be quite careful. I wouldn't linger a long time at the polls. I would fill out your ballot and move on. But I think we're in for some longer lines. I think it's going to be important that people continue to maintain their I guess duty, obligation to vote, but be careful about that. Use common sense. If you are at an at-risk population, you need to take that into consideration as you move to the polls. Keep your distance from people. And if you're not at-risk population, or you're a population that's not at risk, then please accommodate those that are. I would ask people, our citizenry, if we have a person who's in an at-risk portion of the population, let's say in the older age group, provide some leeway, give some space, maybe have them move up to the line first. At the same time, I think we're going to have some polling places that combine. The Wisconsin Elections Commission, I think, is addressing that issue. Instead of maybe a dozen polling places in a geographic location, we might have 2 or 3 or 4. I would ask our citizens, please be patient. Your local units of government, your towns, your cities, your villages, and your county are doing everything we can to make this as minimally intrusive to you as possible. But that's going to require that we all have a little patience. Instead of 10 or 12 minutes at the polling place, you might be there 45 minutes. You can't talk to the person next to you unless you're at least 6-7 feet away. But make that time valuable by having a conversation at a distance. But please give the poll workers a lot of leeway and show a great deal of patience. They're doing the best they can.
The governor and DHS officials, health services officials, hold daily briefings, but they interact with local health departments. What has been the strain of this health emergency on county health departments, Mark?
Protective equipment, by far and away. That's one of the top issues.
Have they run out? Have some of our counties run out?
Our counties, well, if they haven't run out, they're getting close to running out, and it all depends on a daily basis since the numbers are going up everywhere. And that's on frontline workers, our emergency management people, our law enforcement folks, our human services people, really everyone. There's a famous quote saying, "Public health saved your life today. You just didn't know it." Well, now we're in a different time period. Public health is saving your life today, and now everyone knows it. But that requires the right equipment. Granted, the state of Wisconsin, the federal government, they cannot give something they do not have. So we have to be understanding of that. But when we do have it, when it is being manufactured, when it is being delivered to the state, we are very hopeful and actually quite confident that the state will provide that to the local units of government whenever the state has the equipment available. But that is one of the primary, needs at local government level right now, and that is protective equipment.
A follow-up question, Mark. Dr. Westergaard of DHS Health Services said yesterday, when someone tests positive, then officials do tracing in terms of who that individual has been in contact with. Is that tracing done by local county health department officials?
I don't have specific knowledge on that, Steve, but I am guessing that our state DHS is working with, I know they're working with all of the public health departments around the state. I've got to believe that is a integral part of the back tracing of the contacts that an individual may have had, and so we can try to minimize the spread of COVID-19. Let's
move on to law enforcement, sheriff's departments, and jails. What are you hearing from county officials on that, sir?
This is a major issue. Our law enforcement folks are on the front lines, and protective equipment, it wouldn't necessarily come to mind for, regular folks that our law enforcement people need protective equipment, but they absolutely do. Many times they will be the first point of contact for a person that might be infected. In our jails, this is a very significant issue. This is a population that it's difficult to separate and it's difficult to manage. So we are having some very significant challenges in this area. If the virus continues to, I guess, populate and spread as it has been, we are going to have some difficult challenges in our incarceration facilities. We're already seeing it at the state level. We had, I think, 2 cases in the state prison system, and it's a closed community, so it's very easily transmitted. The same is true at a kind of a micro level in our county jails. It's not a major problem at the moment, but it has potential to be.
Okay, let's talk about 2 other areas quickly. Vital services provided by county governments. Human services. Are foster care programs continuing in light of this emergency?
They have to continue, Steve, because as you know, and we've talked about this many times in the past, we've got a giant meth issue in this state and a very large opioid issue in our state, and that is causing significant numbers of our children, our child population, to have to be removed from a home and placed, sometimes temporary and more than temporary, foster care environments. That has to continue, and at these times, and I'm making no judgment on how our population might act, but in times of enclosures or restricted settings, we are likely to see some domestic abuse issues. And in those cases, many times the children will need to be removed from the home. That has to continue. To allow a child to be in an at-risk situation really is not an option. Counties are continuing to perform our functions. We may be limited in terms of hours. We may be limited in terms of contact. We may be compromised in terms of face-to-face interaction and contact, but counties are continuing to perform the functions that we are statutorily required and the state has asked us to perform to ensure the well-being of our citizens. So we're continuing to engage in foster care. We're continuing to engage in at-home visits to the extent we can. We're continuing to care for the population as the state has asked us to do.
Well, one other function I want to ask about. If a jury trial was scheduled to begin yesterday and it doesn't occur until July, what are the implications for that delay and other delays on county court systems?
Yes. Well, I think the county court systems, once we let's assume that there is a lessening or I hate to say an end to COVID-19, but for lack of a better term, let's say we come to the end of it. We are going to see I think significant backlogs of court cases in our judicial system. I know our judges and our judicial employees at the county level will do everything they can to engage in whatever acts are necessary to move things through the process. But to your initial question, some might argue, well, if there was a trial scheduled and it's not going to occur for 6 or 8 months or maybe a year, are we compromising or some sort of not engaging in a speedy trial? I think in these very difficult times, as I mentioned in the beginning, this once in a multiple lifetime situation we're in, I think there's going to be a lot of leeway in terms of if we are doing everything we can to ensure that we are performing in the best manner we can, serving the citizens in the best way we possibly can. I think there's going to be some leeway, and I would anticipate that such allegations or assertions would not be well received by the court system. But we're going to have a backlog once we get through this difficult time.
Let's talk about the $2.2 trillion with a T stimulus package the president signed on Friday. Reading summaries by legislative leaders, and they're referring to the Fiscal Bureau, they said that Wisconsin was in line for more than $2 billion, but only communities above 500,000 would specifically get earmarked funds. So Milwaukee County, of course, City of Milwaukee, and Dane County. First of all, do I have that right? Secondly, does that mean that there's no earmarking for all the other county governments in Wisconsin, Mark?
You do have it right. I guess first let's start off with $2.2 trillion.
Yes.
$2.2 trillion is an enormous amount of money. It's basically $6,000 for every person in our country. It's an enormous amount. We in Wisconsin, we're basically 2% of just about everything. So you could look at it and say, okay, we're in line for a very significant amount of money. Now, on the allocation that the federal government put forward, certain dollars were allocated or reserved for states and municipalities or local units of government that were 500,000 people or more. In our case, as you indicated, City of Milwaukee, County of Dane, and the state of Wisconsin. Those are clear earmarks. However, it does not mean that any other municipality or county with a lesser population is not going to get dollars. It simply means that we have to work with the state to work out an allocation plan and get dollars to where they are needed. So it was the federal government's way to say, in these major, large urban population centers where we're very likely to have a serious affliction of COVID-19, let's streamline the process and get dollars to them right away as clearly as we possibly can. They're not setting aside or neglecting the every other local unit of government, but simply allowing the states to handle that in the best manner the states deem appropriate. I'm very confident that our state of Wisconsin they're working very, very closely with local government. If anything, I mean, it's often said a crisis brings people together, and we see that in Wisconsin as well. State of Wisconsin, local units of government, city, town, village, school district, county, and the state, all working together very closely to try to address this issue.
Well, the legislative leaders wrote a letter to the governor saying, our understanding is after you subtract the allotments for Dane County, Milwaukee County, City of Milwaukee, Governor, you have the sole authority without any approval required by the legislative branch to spend $1.9 billion. Now, Mark, here's my question. Are you and county leaders, what are you going to ask for as this legislative response to the emergency health crisis begins to take shape over the next 2, 3, 4 weeks?
Yeah, it's a good question, Steve. And we are, as counties, we are not the only ones that have needs of that $1.9 billion. Public health departments by far. Our law enforcement community, no question about it. Our human services arena, absolutely. Nursing homes, clearly. There's a whole host of needs. And we're not even talking about the loss of revenue in terms of non-business activity, loss of sales tax revenue, loss of employment. We have a significant unemployment numbers now that are likely to go up even further. We're going to have business closures. As an economist said, I think this morning or maybe yesterday, we're clearly in a recession. The question is how quickly we're going to come out of it. And in a normal recession, you might look at a 12 or 18 month recovery. This is a very different type of recession. This is not a spending recession. This is not an economic driven recession. This is a virus, a medical driven recession. So it's going to be very different. We really have no experience related to that. But we'll be working with the state government to talk about where the allocations should be made, where the needs are, and understanding, of course, that our friends in city, town, village, and school districts, governments, also have needs. And so we'll work with all of those entities to try to properly and most efficiently allocate and properly expend the dollars that the federal government has allotted to Wisconsin.
Okay, you said that counties and local governments want a share of the $1.9 billion, but here's my other question. Do you also think this is a time in this emergency for some of the fiscal restraints to be loosened off of county governments? Should they, I'm reminded of the debate in Milwaukee County, the additional 1% sales tax. Is it time to cut some of these restraints that state government has imposed on your county governments?
Well, it's an interesting question, Steve, and I want to be careful about this because it would be easy to say in a moment of crisis, an entity or such as counties or even cities, towns, to try to take advantage of it and get something that they may have wished for in the regular legislative process and then use this crisis as the rationale for it. That's not really how we would operate. It's not. It may be opportunistic, but it may not be proper. So if we truly do have a need to have restrictions loosened, and we do, That was before COVID-19. It is during COVID-19, and it will be after COVID-19. We are in ongoing conversations with the legislature to determine what kind of loosening of restrictions, levy limits we could work with. We're in those discussions. We'll continue to have them, but we are not likely to be opportunistic and say we need those now because of this. I think it's not very genuine. And in county government, I think, as everyone knows, the people in county government are very genuine, honest folks. And so what is a proper ask, we will make. What is opportunistic ask, not so much.
Okay, then you're not a fan of loosening some of these levy limits and fiscal restraints that are sunsetted for a 6, 9, or 12-month period. You're not a fan of that? I'm just trying to clarify your position.
No, we're very interested in having the conversations. But
Okay.
The conversation, this is a much longer conversation. If we're going to have, it'd be a permanent policy change. So do we believe we ought to have not quite as restrictive levy limits? In other words, only being able to increase our revenues by new construction? Do we believe that should be modified? Yes, we do. We believe that before COVID-19, during, and after. But to say, because of COVID-19, let's loosen the restrictions and then have to go back later and reapply them, that seems a little, that's not long-term public policy. I think we need to be careful. It's not just in this area. We need to be careful that whatever actions we take, we understand the long-term implications of such. To take actions today because we are trying to solve a 2 or 6 or 8 or 10 month challenge, but the ramifications of which go far beyond that, we need to be careful about that and step carefully and think visionary in a more visionary manner, because these kinds of changes, they last a long time.
Okay, and then final question, Mark. Thanks for your time. I really appreciate it. You believe then that the safer at home order, social distancing, is absolutely critical to help all of us, county governments, local governments, state government, get through this crisis?
Well, now that's about half the states have engaged in some kind of a shelter at home or safer at home mechanism. About half the states have not. Some of our neighbors have engaged in that. Iowa has not. I think time will tell us which mechanism was beneficial. Now, by sheltering at home and the safer at home, we have many businesses that will not be around after the COVID-19 challenge. In Iowa, more businesses will probably be around than otherwise would have been. So is it the right approach? I'm not sure that the debate is beneficial or prudent right now. I think there's going to be time for that later. Right now, we have it. And so we need to deal with it and do the best we possibly can. I do think on the at-risk populations, we should do everything we can to assist these at-risk populations so that they do not get afflicted with this disease, with this virus, and then succumb, the ultimate succumbing with one's life. Now, many people will get the affliction and be down and out for a bit, but then come back just fine. I think we're going to have to, as a state, we're going to have to look at ourselves when this challenge has been met and determine how we're going to assist our business community. I mean, we have a substantial public sector in this state, but if we are going to move forward, if we are going to succeed as a state, our private sector has to do really, really well and be very vibrant. This COVID-19 has thrown a major wrench into the moving in that direction. So we're going to have to address it and meet this challenge, but then we're going to have to roll up our sleeves and work really hard to ensure that our private sector can get back to where we were and go even further. And that is going to take a lot of work.
What information is at the Wisconsin Counties Association website on COVID-19, Mark?
We put out a daily briefing on basically everything related to COVID-19. Accessed for all of our units of government, and in fact, our friends in cities and towns as well. You can access the website COVID-19 I think hopefully it's going to show up on the screen. It's COVID-19 at Wisconsin counties.
It's going to be on the screen.
Okay, you can go to the Wisconsin Counties website, wicounties.org, and click the links and find those links. And you can just actually sign up for the newsletter as well. A lot of information, a lot of really good information. We put out everything the governor has produced. We have all the connections to our federal government, the applications, the programs that the federal government is putting forth. A lot of information there on a daily basis.
Mark O'Connell is Executive Director of the Wisconsin County Association. Mark, thanks so much for your time and all the services that your county governments provide.
Thank you, Steve.
This program is a production of WisconsinEye, an independent, non-partisan,
Good, thank you, sir.
Media network with a mission to inform, educate, and engage the citizens of Wisconsin. WisconsinEye is the nation's first and only independently funded state civics broadcast network, providing gavel-to-gavel access to government proceedings and events at the state capitol.